Maybe you constantly worry about what people think about you, or perhaps compliments bounce right off you while criticism sticks for years. Maybe there's that voice deep down inside that says, I'm not good enough, I don't belong, or something is wrong with me. Beliefs about who you are touch virtually every aspect of your life. They affect your friendships and your relationships. They will color your dating life and your approach to parenting. They will impact what you're willing to aim for in your career and how you see yourself in your community. Your beliefs will shape how you see the world, your place in it, and how you'll make decisions. If you want to change deep-rooted negative belief, positive self-talk may not always really give you the results you're looking for. That's because low self-esteem isn't a thinking problem per se. It can be more of a felt sense and truth that lives in your body. If this resonates for you, continue watching as this video may literally change your life. Today, I'm going to dive into the role that early childhood experiences play in shaping identity, self-esteem, and belonging, including examples that draw a direct line from the childhood experiences to the core belief and ultimately to the behaviors in adulthood. I'll then give a brief overview of EMDR therapy and share with you why it's so effective at changing limiting negative beliefs for a more accurate, compassionate one. And I'll wrap up by giving you a list of reasons why I think you may want to give EMDR therapy a strong consideration if you have some limiting beliefs and self-esteem issues that you want to address. These different topics are timestamped, so while I would encourage you to watch the entire video, if you're pressed for time, you can skip ahead to the section that interests you the most. But first, my name is Ashley Phillips and I'm a practicing trauma therapist and the founder of the Kelowna EMDR Clinic. If you're new to my channel, welcome. I create videos about trauma, how it affects people, and my favorite trauma therapy, EMDR. If these topics are of interest to you, I invite you to subscribe to the channel. Not only will it place my future videos in your feed, but it'll also help others discover this information. Okay, so the concepts of identity, self-esteem, and belonging are all interconnected. Identity is basically the answer to the question, who am I? Self-esteem is how we see and evaluate ourselves, and belonging is the feeling when we are accepted, valued, and connected to other people in our community. Our community can be our family, a group of friends, our work colleagues, a rec league that we're in, or any other group that we are a part of or want to be a part of. Identity, self-esteem, and belonging are closely interconnected. If I believe I'm worthy and valuable, it's easier to feel that I belong. If I believe that there's something wrong with me, belonging becomes much harder. The important thing to understand is that these beliefs just don't appear out of nowhere. They were formed typically when we were much younger through different experiences in childhood and adolescence. Children are constantly trying to make sense of the world and their role in it. They are emotional and egocentric by nature, and they tend to assume that difficult experiences must somehow be about them. For example, if a parent comes home short-tempered and frustrated, the child doesn't critically think about the situation thinking, my parent is having a stressful day because of work. No, instead they're thinking, this is happening because I'm bad and they're mad at me. These conclusions can become deeply rooted that continue long after childhood has ended. Let me give you some examples of how different childhood experiences can lead to limiting negative beliefs about identity and self-worth. These are all fictitious examples, but they're based on what I've seen and other therapists have seen here at the clinic, in practice, in research, and in case studies. So first we have Emma, who grew up with parents who stressed academic success and praised high achievement. Pretty early on, Emma formed an overarching belief that she needs to be perfect in order to be loved. Now, as an adult, she feels empty and inadequate without a string of constant accomplishments and achievements. She has a deep fear of failure, is a perfectionist, and has an unhealthy relationship with work. She's chronically stressed, and she's typically always on the verge of burnout. Her health and her personal relationships are always taking a toll. Then there's Daniel, who was bullied in middle school, and he developed a belief system that he is unlovable, and the reason he is teased is because he is defective, that there's something inherently wrong with him. Later, Daniel struggles with social anxiety, low confidence, and hypersensitivity to criticism and rejection. Now take Jordan, whose parents were hyper-protective. She always heard phrases like, don't climb that, you'll fall. Be careful, you'll hurt yourself. Don't do that, that's dangerous. Jordan quickly learned that the world is a dangerous place and, worse off, developed a belief that she can't make good decisions. As an adult, she continues to struggle with decision making and she's very risk avoidant. She also has a lot of self-doubt and as a result struggles to progress up the corporate ladder at work. Or how about Sarah, whose parents were highly accomplished professionals who enjoyed their work and all the financial rewards, but not having a lot of time to parent, they delegated a lot of the parenting to a full-time nanny. Sarah's physical needs were well taken care of, but emotionally she felt her parents were distant. She internalized the belief that my needs don't matter to the people I love. As an adult, Sarah is emotionally detached. She is constantly in unhealthy relationships with people who treat her like she doesn't matter, but she finds it very familiar. Finally, consider JP. He grew up with a highly anxious mother. The belief JP formed is that his needs and problems are too much for people. He feels he needs to be on his best behavior to make sure not to increase his mother's anxiety. As an adult, JP doesn't communicate his needs, thinks his needs are too much, and he becomes an emotional caregiver for others. His outward cool experience hides his very real pain. If you're hearing about EMDR for the first time, it stands for Eye Movement Desensitization and Reprocessing, and it's a trauma-focused psychotherapy developed by Dr. Francine Shapiro in the 1980s. Since then, it's been widely researched and studied and is shown to be very effective at treating PTSD, trauma, distressing experiences, and a number of trauma-related conditions. I like to explain EMDR and trauma to my clients through an analogy. Much like the body heals from physical wounds, the brain will often heal on its own from psychological wounds caused by trauma. Sometimes, however, the mind gets stuck on an experience and it never actually heals, and this stuck trauma will manifest itself in a variety of different ways, with different negative beliefs and low self-esteem being one of them. EMDR therapy helps the brain to loosen stuck trauma, allowing natural healing to resume. This not only reduces emotional intensity of what happened, but a really cool positive consequence of healing from trauma is the elimination of associated trauma related to conditions and beliefs. So while the main mechanisms of how EMDR works is not fully understood, we know that it works. And much like we don't need to know exactly how electricity works in order to light up our houses in the dark, we can use EMDR to the great benefit of our clients. And if you're interested in learning more about EMDR therapy, I have other videos on my channel that I encourage you to check out, including a deeper dive into all 8 phases of EMDR therapy. I'll put the link in the description below. The reason EMDR is particularly useful for self-esteem and identity work is that it targets the experiences that generate the negative belief. It works at the level of the nervous system, not just the thinking mind. When the memory target is processed through EMDR, it doesn't disappear, but it loses the emotional intensity that's been telling the nervous system all these years that there's something wrong with you or that you don't belong. And as that emotional charge reduces, the negative beliefs begin to soften and update. EMDR also has a specific phase called installation, where the more adaptive and accurate belief is introduced and strengthened. The goal isn't unfounded optimism, but rather a more accurate, more compassionate relationship with yourself. So as you and your therapist work together to process the memories that carry these felt truths of negative beliefs like, I'm not enough, I don't belong here, I'm worthless, is replaced with a more appropriate, useful belief like, I am enough, I do belong, I have value. And when taken across the range of experiences that have shaped your identity and self-esteem, you can experience a profound, lasting shift. And this won't happen overnight. It will take time and it will take work. But since we're dealing with the layers of where your actual beliefs live, it can be transformational. And for me as a therapist, there are few things more satisfying than seeing a client having this massive breakthrough and emerging as a new person and how they see themselves. If you're curious about trying EMDR to help you work through identity, self-esteem, and limiting core beliefs, let me share with you the 7 reasons why I think taking the plunge and booking your first appointment will be worth it. Reason number 1, treat the root, not the symptoms. Instead of teaching you coping skills for low self-esteem, by going through EMDR therapy, you will find where your low self-esteem originates and be able to resolve the old wounds that caused it in the first place. This is why I love EMDR. Reason number 2, we can get results faster. Talk therapies often take a long time, years even, to unearth and shift core beliefs. EMDR can work a lot faster in a matter of months or even weeks. Less time in therapy means less money spent and more time about feeling good about yourself. For even faster results, you can try an EMDR intensive. I did a video on EMDR intensives a little while back, and I'll leave a link in the description below. Reason number 3 is that EMDR therapy doesn't require you to recall, recount, and relive your childhood in painstaking detail. EMDR focuses on processing your past experience through your brain and nervous system, not through verbal analysis. Reason number 4, EMDR clears the path for your brain and nervous system to do what it already knows how to do. Our bodies know how to heal from trauma and distressing experiences. EMDR therapy is not about creating new behavioral patterns or trying new tactics. It's about removing the obstacles to healing and getting out of the way. I personally really like that as a therapist. Reason number 5, EMDR will help bridge the gap between the head and the heart. Many people with identity and self-esteem issues know that they're lovable, but don't feel that they are. They know they're capable, but don't feel that they are. EMDR therapy will help bring the knowing and the feeling together so that they're congruent. Reason number 6, EMDR doesn't have a lot of homework. Unlike a number of other therapies, your therapist won't give you a bunch of homework to do in between sessions. I personally ask my clients to keep a brief journal of how they're doing so we can keep track of progress. I also may ask them to work on some self-compassion exercises that we'll go over in session. But other than that, it's less about the homework and more about letting the brain and the nervous system do what they know how to do. And finally, reason number 7, EMDR resolves somatic experiences associated with the target memory or event. Somatic symptoms are just physical sensations in your body, which in the context of identity, self-esteem, and belonging can include symptoms commonly associated with anxiety and behaviors like looking down, looking away, and making yourself feel physically small. This ties back to the first reason why I love using EMDR is that it targets the root cause. And as we treat the root cause, not only can we update the negative belief, but also reduce and even eliminate the physical sensations and soften the mental images associated with it. At this point, you should have a better understanding of how your identity, self-esteem, and sense of belonging are interconnected, and how all 3 are influenced by the beliefs you developed as a result of various experiences when you were much younger and had a far less understanding of the world and your role in it. And hopefully, you'll also learn something new about EMDR therapy and how it can have a positive impact in your life. EMDR is not about convincing yourself that you are amazing. It's actually helping your brain process the experiences that have taught you things that felt true, but are not necessarily so. And when those experiences get processed, you can simply stop carrying around these belief systems that never belonged to you in the first place. If you found this video useful and you're curious to try EMDR therapy, I think you'll also like the video over here, where I cover the possible side effects of EMDR therapy. Okay, I'll see you over there.